You're live with BBC News. The World Health Organization is warning that more people could die in Gaza because of untreated diseases than due to airstrikes if the health system isn't restored there. More than 1 million people are sheltering in overcrowded United Nations facilities as cases of diarrhoea and respiratory infections are widespread. Patients with chronic illnesses like cancer are also not getting any treatment. Well, to discuss this further, I'm joined now by Mike Noyes from ActionAid. Thank you very much for joining us here on the BBC. You've been in touch with your teams in Gaza. If we can begin by finding out a little bit more about what they're telling you about the situation on the ground.
Thank you, Reggie. Obviously, a few days now into a pause, there's a sense of improvement just in terms of the access for our colleagues and for humanitarian workers, and crucially for supplies coming in through the Rafah crossing, although they're still far below meeting the levels of need. That said, with the needs as high as they are, and particularly with the situation that very little of that aid is reaching the north, we continue to hear from our colleagues about their concern for what can be achieved and for the needs. We're continuing to hear from our colleagues that the hospitals that we work with are still lacking fuel, meaning they can't run generators, which is impacting on their basic ability to provide basic medical services. We're continuing to hear concerns about the state of the water system and the lack of fuel to get pumps running, and that. Also, many people, of course, around Gaza, particularly those who fled from the north and to the south, are exposed and living in very poor conditions and lacking basic shelter. I heard from a colleague today talking about 7 families sharing one blanket for the night. The levels of need, the lack of humanitarian aid is still quite crucial, no matter how hard we try.
And one of the concerns is aid getting into the north. We've been talking to other aid agencies in the last few days who say that has been one of the biggest challenges and one of the greatest needs.
Indeed, the hospitals we work with up in the north, and I didn't hear from them today, but as of yesterday, they'd not received any fuel at all, and so it's for them. Yes, the bombardment has stopped, but the pause has really not resulted in much aid getting through to them at all up in the north. And of course, as well as the hospitals, there are still a large number of people living in the north. We're doing what we can in terms of getting people, whether it's in the north or the south, cash through our ActionAid partners on the ground, but obviously cash can only go so far when there's not much to buy in the shops.
And just very briefly, Mike, the WHO talking about the danger of infectious diseases because sanitation conditions are obviously very poor as well now.
Yeah, indeed, this is what we are hearing again from our colleagues in the camps. The number of people using 1 or 2 latrines. I think I heard something like 700 people using 2 latrines recently in one of the shelters down the south. So the risk of waterborne or diarrhea diseases is incredibly high, and as I say, sort of aggravated by the fact that people are living in very poor conditions in terms of shelter and the cold. This is the challenge for us very much at the moment is the pause is helping, it is getting things through, but when the pause is extended on a day-by-day basis, it's very hard for us to scale up and plan properly.
Okay, Mike Noyes from ActionAid, thank you very much for bringing us up to date on the situation on the ground in Gaza. This is The Context. Stay with us.